Hi, this is Linda Rodriguez, and this is my patient, Cesar Rodriguez. I will be performing the head-to-toe examination today. I just washed my hands. My patient is sitting up. First of all, how are you feeling, Cesar?
I'm feeling great.
Okay, we're going to start with the head. I'm going to inspect the head. The head is normocephalic. There's no lesions, no lumps, no scaling. Scalp, I can't see any. No parasites, no trauma, no tenderness. Okay, and to check the symmetry of the face, I'm going to look at the palpebral fissures and the nasolabial folds. Now the face is symmetric. It doesn't show any weakness. I'm going to ask my patient to smile. Now puff your cheeks. Squeeze your eyes and wrinkle your forehead. Now everything is symmetric. And it's also testing for the cranial nerve 4, 5, and 7. So these cranial nerves are intact. Next, I'm going to palpate the temporal artery bilaterally. Pulses 2+ bilaterally. And the temporomandibular joint. I'm going to ask my patient to open and close the mouth while I palpate. Okay, the joint moves smoothly. There's no limitations or tenderness. Next, I'm going to inspect the eyes and test the extraocular eye movement if it's intact. This is a test for cranial nerve number 3, 4, and 6. So the patient should follow my finger while I move the finger cardinal positions. Okay, very good. Next I'm going to test the visual field by the confrontation test. So I'm going to ask my patient to close one eye with his hand, and I'm going to do the same thing with the opposite side. Now I'm going to move my finger out, and I'm going to test the peripheral vision, and my patient's going to tell me now when he sees my finger.
I see it, I see it, I see it, I see it, I see
Say
it.
now.
Now.
Okay.
Now. Now. Now.
Okay, and the other side?
Now. 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 Now.
Okay, very good. Next I'm going to dim the lights, and I'm going to check for the pupillary response, the direct and consensual. I'm going to use my pen light to shine in the pupil. Pupil should constrict. By the second time I go, it's the consensual. It should, both pupils bilaterally should constrict. I'm going to do the same on the other eye. The right pupil constricts, and both pupils are constricting. Very good. So this was a test for pupillary response, direct and consensual. Next I'm going to move on to the ear. I'm going to inspect and palpate the ear. I'm going to pull up the pinna. Should be firm, no masses, no discharge, no tenderness or pain on palpation. Next, the nose should be symmetric. No deformities or tenderness to palpation. The nares should be lower your nose while you hold one nair. And the other side, this should check for patency of the nose. Next I'm going to put on some gloves. And I'm going to check the mouth. First I'm going to ask my patient to open the mouth. And clench your teeth. Now open again. Inspect the lips, the mucosa. Teeth are white, straight, evenly spaced, clean. Mucosa is pink. And now stick out your tongue. Now the tongue should be pink, no lesions, protrudes midline. And next I'm going to check the pharynx. I'm going to use my pen to shine in there. The pharynx should be pink, no exudates, not swollen. Also I'm going to check the uvula. The uvula should rise midline. And I'm going to let the patient say ah. Okay. So the uvula rises at midline, and now stick out the tongue. Okay, the cranial nerve, go put it back in. The cranial nerve 10 is intact. I'm going to check for tongue movement. Open the mouth and move your tongue left to right. This is also how you can check the cranial nerve number 10. Okay, next I'm going to palpate the thyroid from posterior only. I'm going to take off my gloves. But you can keep your gloves on. So posterior, I'm going to go from left to right. I'm going to push it to the right and to the left. And I'm going to oscillate with the belt the carotid pulses. Excuse me. While I'm doing this, I'm going to tell my patient to hold the breath. Okay, left and right bilaterally. And you should hear no bruits or swooshing sounds. Now on the thyroid, it should be non-palpable, not swollen, or there's no enlargement visible. Next I'm going to check for the lymph nodes. So I'm going to palpate the lymph nodes. I'm going to start with the pre-auricular. I'm going to take three fingers here. And I'm going to palpate the pre-auricular, the post-auricular, the occipital, tosellar, submental. This is submaxillary, and anterior cervical, and posterior cervical, and now subclavicular. So the lymph nodes are not swollen and no masses are felt. The heart, moving on to the heart, I'm going to start oscillating the heart with the diaphragm of my stethoscope. This is going to be done in the sitting position. I'm going to start with the aortic, pulmonic, herbs, point, tricuspid, and mitral. Now you can oscillate or feel the apical pulse at the fifth intercostal space in the left. Midclavicular line should be no thrills. S1 and S2 should be normal. Rhythm should be regular. and no S3 or S4 should be heard, no murmurs. Now if you want to listen for S1, S1 is louder and then S2 at the apex, and S2 is louder than S1 at the base. So while you feel for the apical pulse, use the bell at the apex of the heart and to listen for S3 or S4, but it should normally not be heard. Okay, next I should check the radial arteries bilaterally, should be 2+. Now if you lie down, I can lie down. I can show how you can feel for the posterior tibialis pulse and the dorsalis pedis pulse. Should be bilateral. Other foot. Right here. And right here is the dorsalis pedis. Should be equal bilateral, 2+. Now if you sit up again, I'm gonna percuss the lung fields, posterior only. So I'm gonna move to the back of my patient. I'm gonna percuss down the scapular line. And you should hear resonance, and where it changes to dullness, this is also called diaphragmatic excursion. Next, I'm going to assess for tactile phrematus, so I'm going to use both the balls of my hands, and I'm going to ask my patient to say the number 99.
99. 99. 99.
You can also do this in the front.
99. 99. 99.
You just assess if it's heard, if you hear the resonance bilaterally equally. So my patient is resonant to percussion over lung fields. Next I'm going to auscultate while the patient has the mouth open. So I'm asking my patient to breathe in and breathe out while the mouth is open. I'm going to do this posterior and anteriorly. Now I'm going to ask my patient to lift up the hands while I assess the lateral lung sounds. So the vesicular breath sounds are clear over the lung fields. Note Wittgenstein's lung sounds heard. Next, I'm going to ask my patient to lie down. Now I'm going to assess the abdomen. I'm going to expose just the area of the abdomen. By inspection, the abdomen is slightly rounded, the umbilicus is midline and inverted, and the skin is smooth with no lesions. So I'm going to start auscultating in the right lower quadrant, and I'm going to go clockwise. Okay, so vowel sounds are heard in all 4 quadrants. I'm going to auscultate also for the aortic, the renal, the iliac, and femoral vascular sounds. Aortic is here. Now renal, iliac, and femoral. Okay, moving on to percussion. I'm going to go same clockwise, the same way as I did auscultation. Timpani should predominate in all 4 quadrants. Also percuss for the liver span. So the liver should be bordering on the should be mid-clavicular line in the right, on the right side. I'm going to palpate for the liver. Just pressing down. You can feel the edge of the liver while you move your fingers up. So light palpation. Feel for any masses or tenderness. And deep palpation using both hands. Notice if the patient has any pain while doing this. And well, I already palpated for the liver. I can palpate for the spleen on the other side. And but usually the spleen is non-palpable. Same with the kidneys. Now the aortic pulsation should be felt in the above the umbilicus. You can palpate for, should be slightly to the left of the midline, about 2 to 5 to 3 centimeters wide. Now my patient didn't deny any pain while doing this, correct?
Yes.
Okay. Next I'm going to ask my patient to sit up. And I'm going to assess the muscular and neural system. First I'm going to ask my patient to rotate the head against resistance to my hand on both sides. Okay, this is testing the cranial nerve number 11, which is the accessory nerve. Same with the shoulder stroke against resistance. Testing the same nerve, cranial nerve number 11. So cranial nerve number 11 is intact. Next I'm going to move on to ask my patient to pat the knee with a palm and palm down, alternating as fast as you can. This test for fine upper extremity, fine motor, and coordination. Next, I'm going to use the rapid alternating movement finger to finger. So I'm going to move my finger and you try to touch it with yours. Okay, very good. Next, thumb to each finger, thumb test. Bilaterally. Shows very good coordination. Next, please lie down again, and we're going to do the heel to chin test. Very good. So you check for the heel and move it all the way up to the knee and down, and do this bilaterally. And this test for okay. Good lower extremity fine motor and coordination. good coordination. Next, I'm going to ask you to sit down again, and I'm going to test reflexes. I'm going to test the triceps reflex. So I'm going to hold my patient's upper arm, and I'm going to use a reflex hammer, which right now I don't have, but pretending I have a reflex hammer. And I'm going to strike the triceps tendon, and the forearm should move, extend. Same on the other side. Let your arm hang, strike the tendon, and the arm should move an extension. Next, I'm going to do the same on the knee. I'm going to strike the patella, and the leg should move into extension bilaterally. And lastly, you do the same with the Achilles tendon. You strike the Achilles tendon and the foot. Check for the reflexes. They are all present. Lastly, I'm going to assess the position sense of the great toe. So I'm going to move the great toe up and down, and my patient tells me if I'm moving it up or down.
Down, up, down.
You do this bilateral.
Up, down.
Very good. And I'm going to use a tuning fork to assess the vibratory sense in the great toe. So I'm going to place the tuning fork on the bony part of the bony surface of the great toe. I'm going to pretend I have a tuning fork now. I'm going to place it here, and my patient is going to tell me if he feels the vibration. So, I don't have a tuning fork now, but I'm going to pretend I'm doing it. So this tests for vibration and position of the great toe. So these sensors are intact. And lastly, I'm going to ask my patient to stand up. So I'm going to ask you to put your hands to your body on a straight line. Put your feet close together and close your eyes. And this is called the Romberg test. You should see no swaying, no loss of balance. So the Romberg test is negative. There's a good sense for balance. Next, I'm going to ask my patient to walk in a straight line and do the heel to toe walking backwards. This should be done without losing any balance, and that would complete my head to toe assessment. I'm going to wash my hands and I'm going to document my findings. Thank you for watching.